Well, good morning, everyone. We're going to give Linda a little break up in Toronto. We're back here in Buffalo, and let's remember, it's Great Look Monday, and that's why we welcome in Dr. Todd Shatkin from Aesthetic Associates Center on Main Street in Snyder. Good morning, doctor.
Hey, nice to be here.
Well, good to have you here on the program. You didn't have any trouble driving in, right, in the weather?
Well, it's not too bad this morning.
All right, we got a hot topic to talk to you with the doctor this morning. We will take your calls at 644-9840. Doctor, what's new on the dental front? You've taken care of a young lady, I understand.
Yeah, I wanted to talk a little bit about what we can do to improve people's smile, especially those who have perhaps something they're born with. And I want to show some pictures of a girl named Lisa who had some congenitally missing teeth. And the phone number is covering, but you can see she's got a missing tooth, and she's got a what we call peg-shaped lateral incisor on the one side, some spacing between her teeth. She's 13 years old, and we wanted to make her look, good for school because she's been disappointed in her smile.
13 is a tough age when you in school, because that's the beginning of the awareness of how you look to others, how you want to look to yourself. And
of course, I want people to know that this can be done on children. You don't have to wait till you're 16, 17, 18. You don't have to go through those developmental years with an unattractive smile. And here we improved her teeth.
Oh, wow. Look at that.
With some veneering on the front four teeth, and she looks fantastic, and she's been smiling. I did this last week. I got a phone call from her mother. She was almost in tears. The father brought her to the office. She got home. The mother was so happy. And
so you accomplished this in one visit?
Yeah, this was done in one visit.
And you only worked on the uppers or lower teeth?
Just the top four teeth.
Just the top four.
Yeah. We closed.
Look at it. Now that's the before, and that's the after. Yeah. That is absolutely fantastic.
And so, of course, we do this on young, middle-aged, and old.
Yeah, she may have been 13. You can do it on somebody who's 60,
sure,
if they want to have it done.
Yeah.
What's involved in that, doctor? What is it you had to do, literally?
In this case, we did some veneers, and we do them. The veneers are made right in the laboratory, right in our building.
Okay.
In our second floor laboratory, and it's a very wonderful procedure for people. The porcelain veneers, the porcelain crowns, porcelain bridge work, whatever people need. And of course, we've talked about implants, in the past for replacing missing teeth, and all of that's done right in our premises. And now one thing I want to mention is exciting. In the past month or so, we've got our own in-house denture laboratory as well.
Wow!
So we make the dentures. Everything is made right in-house.
So you're sort of like just your one-stop dental shop.
Well, you can call us that. We can actually do denture repairs, relines, rebases the same day. We can make new dentures in 24 hours for somebody if they need new dentures. So there's very quick turnaround, but the quality is just perfect. I've got people working there. The denture person that works with me has had over 38 years of experience doing denture work.
Well, that's good to know.
He's a very, very, very one of the best in the area.
Doctor, how has this shortened the time from what it used to be if somebody needed a repair on their dentures, or what you did for this young lady?
For example, with anything that you can do in-house obviously shortens the time, and for dentures it typically would take 2 to 3 weeks with about 5 or 6 visits to the office to make dentures. And here we can do it in 24 to 48 hours.
And you do this because everything is right there on premises at
and we can have the patient come in, take their impressions, and have them wait about a half hour. Then we can do a try-in right there because the lab will set the teeth up right while they're there.
Now, getting back to the implants, that's something that does take a little longer, right?
Well, the mini implants don't. The mini implants that's a procedure I developed. I have my patent on. We can do that in one visit. We can put an implant and a crown in the same visit.
Wow.
So, and even multiple teeth can be replaced in one visit.
It probably wasn't that long ago that the stuff you're now doing commonly in the office was science fiction.
Yeah, it took about 9 months to a year to get an implant tooth replaced just a few years back. Yeah. And now we're able to do that. And we can stabilize their dentures. It's just terrific things that are available. And I want to let everyone know that we offer complimentary consultation. So if you're not sure if you're a candidate for any of these procedures, please call us. Come in for a complimentary consultation, and we'll talk.
Now, the young lady we were talking about earlier, I think you said her name was Lisa.
Yeah.
How long was she at your office? How long was that four-tooth?
That was done in about an hour and 20 minutes.
Doctor, that is amazing.
Yeah.
That really is. Was numbing required?
No.
Didn't even have to numb her mouth?
She didn't have any pain. And when I showed her the mirror, she was like, wow, you know, because she'd been looking at her smile the way it was for so long.
So many people are so afraid of dentists because of the misconception or perceived pain factor, but you folks are very sensitive to anyone that has a low pain threshold,
Well,
aren't
for
you?
sure. In fact, we use nitrous oxide if somebody needs that to relax them. We have that available. We also have sedation dentistry, where an anesthesiologist will come in and give you an IV and sedate you if you really need to be knocked out.
Yeah.
But most of the procedures nowadays are very simple and easy and painless.
We have a phone call. Good morning.
Hi.
Hi.
My name is Niger. Thank you. Good morning to both of you. And Dr. Shatkin, you're able to explain things so simply. The question I have for you is, what's the difference between a bonding and a veneer? And what does one veneer cost and one bonding cost?
Okay, well, that's a great question. Bonding is a plastic coating that's placed on the surface of the tooth, done by me in the office, okay?
All right.
And the material is bonded to the surface of the tooth. A veneer is something that's made in the laboratory, and it's made from an impression or mold of your teeth, and that takes a little more time, usually a week or two to have made, but can be done quicker. The cost is about half for the bonding, but they last about half as long.
Okay.
The bonding only lasts on average about 5 years. Porcelain veneers can last 10 years, 15 years, sometimes even longer.
Oh, that's great to know.
So
And
those are the
before we run out of time, we want to let folks know you have a special going on your whitening
Yes, on
procedure.
the teeth whitening, up until the end of the year, we're offering $150 off on the whitening. So it's $350. That's an in-office Zoom plus whitening, which is the state-of-the-art in teeth whitening.
One visit, you'll come out of there, you'll be stopping traffic with your teeth. Doctor, thanks for being with us this morning. We want to let you know Aesthetic Associates Center is at 2500 Kensington Avenue in Amherst. You can reach them for an appointment or consultation at 839-1700. And the preceding segment and photos used brought to you by Dr. Todd Shatkin at Aesthetic Associates Center.